everyone, my name is Diana David, and this is my persuasive speech about how vaccines save lives. The CDC website estimates that vaccinations will prevent more than 21 million hospitalizations and 732,000 deaths among children born in the last 20 years. Despite the U.S. immunization program's success, according to CDC officials, 189 Americans had measles. In 2011, 220 people in the U.S. were reported as having measles, the highest number of annual cases since 1996. This year's 22nd anniversary of the Vaccines for Children program is a direct response to measles resurgence in the U.S.
Okay.
Early vaccination in children will avoid hospitalizations, prevent diseases from occurring, and therefore save lives. Parents should allow their children to be vaccinated, raise awareness about immunization, and stopping outbreaks where they start. This will be the most effective and least costly way to prevent disease or illness. Now let's talk about the vanishing vaccinations. What is the problem? Claim number one, anti-vaccination sentiment is growing fast in the US due to controversial link between immunization and autism. Non-reputable websites publish alarming risks about vaccines, and the internet worsens fears regarding vaccination safety. Parents are now refusing immunizations, fearing that vaccines would do harm than good, that it will not fully protect against underlying disease. Claim number two, religions and philosophical beliefs. State legislatures and health departments now face a difficult challenge, respecting individual rights and freedoms while safeguarding the public welfare. The truth is, if children aren't vaccinated, they can spread disease to other children who are too young to be vaccinated, or to people with weakened immune systems, such as transplant recipients and people with cancer. What is the solution? Early vaccination in children is the best way to make sure that they are healthy and protected from preventable diseases. Outbreaks of preventable diseases occur when many parents decide not to vaccinate their children. Vaccination is safe and effective. All vaccines undergo long and careful review by scientists, doctors, and the federal government to make sure that they are safe. Government agencies such as FDA or the Food and Drug Administration spent many years to make sure that vaccines are safe. Claim number two, raise awareness about the importance of vaccines. Organizations such as the American Academy of Pediatrics, the American Academy of Family Physicians, and the Centers for Disease Control and Prevention all strongly support protecting children with recommended vaccinations. Vaccine-preventable diseases such as measles, mumps, rubella, polio, smallpox, tetanus, and influenza are readily available almost anywhere in doctors' offices, hospitals, and pharmacies. Now let's talk about the positive visualization. Immunity protects us from disease, and our immune system recognizes germs that enter the body as foreign invaders, called antigens, and produces proteins called antibodies to fight them. Our system can produce antibodies fast enough to keep it from causing disease the second time. Vaccines will help prevent bigger medical expenses and outbreaks. It will help us save $295 billion and a total of $1.3 trillion in societal costs over time. Measles vaccination has played a key role in reducing child mortality. And in conclusion, vaccination prevents hospitalizations and deaths. This will also prevent future outbreaks and cut down cost of medical expense. Please do not skip or delay vaccines, especially children, while they have yet to strengthen their immune system and are more susceptible to contracting an illness. Despite the spread of U.S. immunization program, there's still a high number of measles and other preventable viruses reported. These hospitalizations and deaths could have been easily prevented if these patients were given vaccination early on. Again, vaccination is safe and effective. We all have a public health commitment to our communities to protect each other and each other's children by vaccinating our own family members. And that concludes my speech. Thank you.